I'm providing privacy. Hi, my name is Elena. I'll be a nurse today. How are you doing? Patient state that is fine. Okay, so today we're going to do a quick assessment over the eyes, ears, mouth, throat, and nose. It should take about 3 to 5 minutes just to make sure everything is intact and okay. Patient states that it is fine. All right. If you can just give me your name and date of birth. And as I look at the armband, the patient says the correct name and date of birth. All right, thank you for that. All right, and so do you have any allergies or any pain at this time? And the patient state they don't have any allergies or any pain. Okay, so I'm just going to inspect and assess those areas. So I might touch those areas, and I'm just going to be looking for any abnormalities. Is it okay? And the patient state that is fine. Okay, so we're just going to start off with the eyes. Just to look at them, just inspecting, so I don't see any disformities. I'm sorry, I don't see any discharges or any redness. And so now I'm going to inspect the conjunctiva and the sclera. So if you can look up for me, and I'm going to pull down the lower lid, and the patient does that. Okay, and I'm looking, and I see that the sclera is pink and moist. I'm sorry, the conjunctiva is pink and moist, and the sclera is white. Okay, all right, thank you for that. And so now we're going to do the 6 cardinal test. So if you can just follow my pen light, don't move your head, just follow with your eyes, okay? All right, so with this test, I'm just going to go in and out and back to the center. Go clockwise for the patient. And for this test, I would look for any abnormalities. So I don't see any apoptosis, I don't see any strabismus or nystagmus. All right, and so I'm going to go inward. Just look at the top of this pen light, okay? Just don't move your head, just go in with your eyes. And the patient does is so. Okay, and so now I'm just going to shine a light into your eyes just to take a few seconds just to look and see if your eyes constrict. So I will use my pen light and I'll look at this side, and the eye on this side it constricts. Okay, good. I'm gonna do this side and the eye constricts. Okay, so for this part, I would note that the pupil is equal and round and reacts to light, and it passes the accommodation test. Okay, thank you for that. And so now we're going to go to the ears. So I'm just going to inspect the outside of the ears, okay? So I'm just going to look all around, look in the back, because most patients have bruises in the back from oxygen, so the oxygen or whatever that's hooked to the face. Okay, and I don't know any redness or discharge or lesions, and the ears seem to be intact. Okay, so that's fine. All right, and so I'm sorry, and no discharges. All right, and so now we're going to inspect your hearing to see if your hearing is okay. So I'm just going to whisper 2 words to you, and you just say the 2 words that you hear, okay? Patient states that it's fine. Okay, they say the correct words, and they say the correct words. Okay, great, thank you. All right, and so now we're going to go to the nose. So I'm just going to be inspecting the outside of it and then the inside. The patient nose looks symmetrical. The septum is in the middle. I don't know any disformities, and the patient nose doesn't look inflamed to me, so that's a good sign. All right, and so we're just going to check and see the patency for it. So if you can hold one nostril and breathe in and out, patient does so. Do you have any problems breathing? And the patient says no. Okay, if you can do the other side for me, breathe in and out. Do you have any issues breathing or any drainage? Patient says no, so I don't see any drainage, and the patients look like they're breathing just fine, so that's a good sign for that. Okay, and so for the last part, we're just going to do the lips, gums, and tongue. So if I can just inspect your lips, okay, and then stick your tongue out really far for me. The patient does so. Okay, and then I'm inspecting the throat as well. So if I can just look at the throat. Okay, good. All right, So I note that the lips, tongue, and throat is appropriate. The tongue and the throat is pink and moist, so that's a good sign. Everything is intact, so if I can inspect your teeth, just smile really big for me. Okay, and then I'm going to look at the gums. So at this point, I would put on gloves, and I would look at the patient's gums to note to see if I see any conjunctivitis or any lesions or anything. And the gums is like, hold it on. How do I say this? The gums is pink and moist, and I don't know any disformities on the gums at this point. The uvula is midline, and the tonsils is +1, and the gag reflex is also present. All right. So thank you for your time. Oh, I'm sorry. And all 32 teeth is good, and I don't note any decay. All right. So I want to thank you for your time today. I just want to reassess. Do you have any pain at this time? The patient says they don't have any pain. Okay. Is anything else I can get for you? Any water, anything? All right. And they asked if I could lower their bed. So at this point, I will lower the bed, and then I will bring you the call light right here. So if you need anything, I'm just a call away. Just press that button. Okay. And I just want to thank you for your time today. Okay. All right. And the patient says thank you. All right. Thank you.